Hi, my name is Robert Chelle with Chelle Law, and I'm an attorney that assists physician assistants with employment contract and independent contractor agreement issues. Today I'm going to go through a physician assistant's employment agreement checklist, just some main things that a PA needs to make certain are in their contract or clarified, so there's no kind of problems down the road. First thing would be compensation. You could be on a base salary, which is the most common for a PA. Perhaps you're on some kind of productivity-based agreement. If you're with a hospital or health network, it could be RVU-based. If you're out in private practice, with a physician group, it's generally collections. The biggest problem with the compensation, base salary is obviously very simple. You work, you get paid, on the normal payroll, and that's it. If you have some kind of hybrid model of productivity along with a base, or you're just pure collections or productivity, the main things you want to make certain are in your contract are: when are your bonuses paid? It needs to say it, within 30 days of the reconciliation period. And then if you're paid on collections, you need to make certain that you are getting credit for any of the work that you did in the last month or two of your contract. I'll give you an example. So any contract that you sign is going to have some kind of without cause notice, meaning if you want to leave, you have to give 60 days notice. You work out 60 days and then you're free to leave. Well, if you have a collections-based contract that says you get, let's just say, 40% of any of the collections of the practice, but then it has language that says any of your compensation terminates on the day the contract ends or the last day you provide care, you're missing out on 30 to 60 days of collections. A normal accounts receivable cycle for an insurance claim, I'm just using this as an example, could be 30 days. And so if you think about it, the last month that you worked, none of that money is coming into the practice for 30 days. And so if you get no credit for it after the contract terminates, you essentially work for free for a month, which nobody wants to do. So you want to make absolutely certain that there's language inserted that says there's some kind of window, 90 days minimum, where you'll get credit in the collections percentage of any of the collections that come in after the contract terminates. So that's the first thing on the checklist. Next, malpractice insurance. Is it an occurrence policy? Is it a claims made policy? Who's responsible to pay for tail? This needs to be clearly spelled out in the contract. You need to make certain what type it is, who's responsible for tail. Then I think it's also a good idea to find out who's the insurance carrier, what's the annual premium, and then you can forecast how much you'll have to pay for tail if that's something that is required in the contract. Next, work schedule and locations. What are your hours where you have to work each week? Physically, what locations you're at. Sometimes you're at a practice that's multiple locations in the area. You don't want them screwing around with you having to be in a different office on a different day. So making certain that's spelled out in the contract. What's your schedule? Where are you working? What are the call requirements? If this is a practice where you have to take call, it needs to say how much and how it works. Is it just after hours call? If you're in some kind of hospital-based employment agreement, do you have to go in? Do you have to do any coverage? Do you have to round? Any of that kind of stuff. Those should be spelled out. Most employers don't want to put the details of that in the contract, but it's very important that it's spelled out. Next, restrictive covenants: non-compete, non-solicit, non-interference. These are very important and can affect the PA down the road. I'll just give one kind of huge red flag area you need to make certain. A physician assistant is, has more flexibility than a physician. For a physician, you can only really do what you're, trained in, did residency in, board certified in, whereas a PA can kind of move around to the different specialties without many problems. So in the non-compete, there's three components: the scope, so what you can't do, how long you can't do it, and then where you can't do it. And so in this scenario, if you're a PA, you don't want it to say you can't practice as a PA for 1 year and 10 miles from the primary practice location. If you're working in an orthopedic clinic, you want to say you can't work as a PA in orthopedics for 1 year and 5 miles. Yes, maybe this is your specialty, you don't want to leave orthopedics, that's fine, but you want to have maximum flexibility. And in the scenario where you can't leave an area, can't find anything outside, the 10-mile radius, for instance, you want to have other options so that you can work in another area for the 1-year period, get through it, and then maybe you can hop back into orthopedics after that. So make certain that the scope is specific to whatever the employer's specialty is. Next, termination. How much notice do you have to provide? Do you have to pay back any bonuses? Sometimes if you've received a signing bonus or relocation assistance, they'll make you stay for a period of time or have to pay it back. And then benefits. Are they paying for your dues and fees? How much are you getting for continuing education? Do you have health, vision, dental, life, retirement, disability, any of that type of thing? So there's just normally kind of a set of things that I'll go through with any PA when I'm reviewing their contract, just to make certain we're hitting all the areas and that they're fully informed about what they're signing. All right, if you have any questions about an independent contractor agreement or employment agreement, feel free to contact my law firm at the information listed below in the description. And I appreciate you watching the video. All right, thanks. Take care.